Part of the one-week lined-up events to mark the World Patient Safety Day, stakeholders in collaboration with the Federal Ministry of Health and World Health Organization have called for a national policy on healthcare quality and the establishment of a national regulator for the safety standards in Nigeria. Part of the issues discussed were on how the healthcare practitioners, including doctors and nurses, can manage the chances of harm patients are most times open to, as well as the need for academia to integrate patient safety in curriculums. Victoria Agui has more.
Using a visual illustration, Professor Sonny Isimide, Director of Patient Safety Africa, noted that the existing culture in Africa must change in order to incorporate the process of risk reduction and to ensure patient safety.
What we're seeking is a culture change. The processes, the behaviors, the attitudes, the environment, in fact, the whole culture, the system of doing things must change to have the patient move from the edge of care to the very heart and the center of care. This is what it's about. And so the policy today that we are presenting is about, moving patient from a position where the patient is begging to be accepted to the point where the patient is actually the head of the healthcare system.
Professor Isimide, who applauded the support by the government and civil society groups, said a lot still needs to be done in elevating the voices of patients.
Knowledge is power, they say. At the moment, as you can see, that we struggle with the word patient safety, talking about patient safety to many people, and we have to use quality of care, because it's still not comfortable anytime you use patient safety. They think you're about to criticize them, So if we catch them young from the medical school, from the schools of nursing, begin to teach them using the World Health Organization, patient safety curriculum, the multi-professional version, which we're trying to set up at the Federal University of Health Sciences, Otukpo, that will be great, catching them young, so that by the time they graduate, 3-4 years later as doctors, they already have the basics of patient safety. At the moment, we're trying to teach people who have been confident in doing many things and unfortunately many things wrongly. And it's very difficult. You have to unlearn to learn in order to lead.
Meanwhile, a member of the Patient Safety Policy and Strategy Document Development for Nigeria, Steve Abbas, speaks on the policy document and its milestone achievement so far.
Is that we have gone through a series of processes, beginning with some gap analysis to identify the gaps that exist, and then to consult with stakeholders, and there's an array of them: clinicians, academicians, regulators, NGOs, and a host of them, to seek their views, to seek their input. And we have put together all this input. We have reviewed the existing laws that we have in Nigeria, the National Health Act, the National Policy on Health, and so on. So we've put all this together, and then we've come up with policy direction, which serves as a roadmap on how we want to get from where we are now to where we want to be, using the WHO framework. We have also said, so how do we achieve this? We need a strategy to achieve this. And the document we are presenting today provides that strategy.
He noted that both nurses and doctors are responsible for the transformation of healthcare quality in Nigeria.
Everywhere in this country, as you assess care, every strata of that care is provided in such a manner that we are using utmost care, you are safe, and you do not assess health and then come up with complications or issues or harm, as we put it, from assessing that health care.
The Nigerian National Patient Safety and Quality of Care Policy document provides a guidance on the effective implementation and institutionalization of the Patient Safety and Quality of Care program in health facilities to improve safety in health service delivery. The policy sets out government's plan to ensure quality in healthcare and to continuously improve the care that is being provided by healthcare workers. In Abuja, Victoria Agbe, reporting for Kaftan TV News.